Listen, I'm your moderator for this morning. Some technical information. If you run into technical problems during this webinar, this is what you can do. Please check your own equipment and connections and review the information in your registration email or your reminder email to deal with any problems. Please visit the GoToWebinar help screen at this link and scroll down to number 4 for information on solving audio and video problems. The link will be put into your chat box, I believe. If these options do not work, you can leave the webinar, exit your browser, and then try to log back in. You could also log in using a different browser. What we've found is that restarting your computer can solve certain problems. You will notice that we are using GoToWebinar. We are not using Zoom. I know many of us have gotten very comfortable with the Zoom platform, but this is a webinar. Therefore, it will be different from what you might be used to in a virtual meeting, such as a Zoom meeting. So you will not be seeing other participants, and you actually will not have access to the chat function. We have these difficult times when virtually everything has been halted, including immigration. Many of us are concerned about the impact on people in our communities, as well as immigration in general, on refugee protection and the overall movement of migrants. This is a timely presentation, and we are grateful that Dan Hiebert agreed to wake up at the crack of dawn in Vancouver and get online to do this virtual presentation. Many of you online know Dr. Hiebert, who is a professor of geography at UBC, who specializes in issues of public policy. Professor Hiebert's personal research interests focus on immigration policy, the integration of newcomers into the housing and labor markets of Canadian cities, and the consequences of the growing superdiversity of Canadian society. This work routinely takes a collaborative approach, working with partners in government and the NGO sector. Dan, welcome to the OCASI webinar. The floor is yours.
Well, thank you so much, Debbie. I am just going to take a minute to do the technology to share my screen. So let's hope that works as efficiently as it did 5 minutes ago. By now, people should be seeing my screen, and I'm just now maximizing the size of my slide show. And hopefully that will, okay. Somebody tell me if this is not working, but at least I see it properly on my screen, that the full size of the slide. So I want to first begin by thanking OCASI very much for making these arrangements to have me speak with you this morning. Thanks everyone for coming. I want to thank particularly Debbie and Manoli for their support over these last days in getting this prepared. As you can see, I'm going to be talking about what's happening now with COVID and migration. Well, the title says globally, but in a second I'm going to say mostly this is about Canada. So let's move in then to the first slide, which just sets the agenda. So I want to start by talking about just the significance of COVID as a crisis, and I think it's really useful to refer to it as a triple crisis, and I'll explain why I say that in a few minutes. Then I'm going to go on to speak about Canada's and especially IRCC's response to COVID. That will lead to an update of the most recent data we have access to on what is happening in respect to both temporary migration and permanent immigration to Canada. Then I'll spend a few minutes reflecting on Minister Mendicino's new levels plan for the coming 3-year period. And then say a few things about consequences. And then, as you can see on the note at the bottom of this slide, nearly everything I will say in the presentation itself will be about Canada. I will make just a couple of comments about the global scale, but I'm quite happy to deal with that if you wish to in the discussion section that occurs after the presentation. Okay, so let's start then with the first point I really want to think about for a minute, which is just how decisive and important the COVID situation is. And when I say triple crisis, what I mean is we all know it's a health crisis, that's obvious. We all are pretty aware of the fact that it's an economic crisis, but I think that Canadians are not sufficiently aware of the extent to which COVID is also what you could call an equity crisis or a humanitarian crisis, depending on which scale you're looking at. I think when we look inside Canada, the term equity crisis is probably the best way of putting it. When we look globally, the term humanitarian crisis is probably best to characterize the situation. And in crises, what tends to happen is that groups that are already suffering marginalization suffer disproportionately more, whereas groups that are already privileged tend to suffer less. So therefore, when crises happen, what we tend to see is a polarization of outcomes across society. Okay, I won't dwell on this slide for more than 10 seconds. This is just, the case count in Canada. As you can see, it's very alarming, especially just now as we seem to be continuing a worsening set of conditions. You can see there the global thing. Everyone is completely aware of this. Next, I'll talk about COVID as an economic crisis. And for this, what I've done is I've gathered together the purple chart shows the level of monthly unemployment over the last 40 to 50 years. And then I tacked on at the end what's happened over the last year in terms of unemployment in Canada. And I wanted to just give a picture of how serious the COVID recession is compared to earlier recessions that many of us have experienced, depending on our age. I'm old enough to remember all of them. So there was a recession in the early 1980s. The peak unemployment in that period rose to 13.1%. There was another in the early 1990s. Peak unemployment went to about 12%. And then there was the global financial crisis of 2008, 9, and 10. And the Canadian unemployment rate went to 8.7% at that time. It's also instructive when you look at that purple chart to see how the slope on the left side of each of those crises is very dramatic, and then the slope on the right side is less steep. What that means is when there's a crisis, unemployment shoots up very quickly, but then it takes a lot longer to go back to normal. So there's always like a recovery time that can be quite extended after a serious recession. And if we look back at these last 3 recessions, it took about 6 years to get back to normal unemployment rate in the 1980s, again 6 or 7 years in the 1990s, and actually 8 years to get back to the previous rate of unemployment in the global financial crisis. Another sad but important thing to note is that when a crisis occurs, oftentimes we think of the job losses as temporary. We think that businesses have to reduce their labor force for a short time and they'll get it all back again. That actually turns out to be often not true. And of all the temporary layoffs over the last 3 recessions, it turns out that 45% of them were permanent job losses. So basically, when the economy rebounds, it's a different set of businesses that hire almost half of the workforce that had lost their jobs. There's a lot of transition, a lot of churn in the labor market associated with recessions. Okay, so that's the recent history. What's happening now? Well, the peak unemployment for the COVID recession occurred in May of this year, and it was actually a little bit higher than even the highest of those last 3 recessions. It was 13.7% back in May of 2020, and it has fallen quite dramatically to be about 8.9, or let's call it 9%, as of October of this year. So we've seen a sharper peak in unemployment than we've seen at any time since the 1930s. It's also important to note, though, that I don't think we're seeing the real unemployment figures of Canada, because Canada is engaged in the Canadian national government, that is engaged in a huge stimulus program that is spending on a level we've never seen before in terms of trying to keep the economy afloat during a recession. And the chart at the bottom of this particular slide gives you an indication. So this is the extent to which governments have added to their debt as a proportion of GDP. And you can see that Canada has actually engaged in more stimulus spending than any of these other countries around the world, such as Britain, the United States, Brazil, Italy, etc. You can read the names yourself. So what that tells us is that when Canada stops this stimulus spending, we are going to see a more abrupt transition than any of these other countries, because there's that much more artificial stimulus being put into the Canadian economy compared with other countries. That's something I'll come back to later when we think about the consequences of COVID for future immigration, and especially the employment of immigrants. Okay, one more slide on COVID as an economic crisis. This is from Canada's labor force survey just a couple of months ago, and it gives you an indication of the job losses during the recession across the different sectors of the economy. And I don't want to, of course, go through all of them, but I'll just mention the top three. So that's accommodation and food services, retail trade, and construction. And what I'm hoping that all of you are thinking right now is, well, wait a minute, where are immigrants typically located in the Canadian economy? And those are three sectors that have very dramatic levels of immigrant employment. So that leads us then to the next point about COVID, which is COVID as an equity crisis. And this chart begins to get at this, and I'll show a few more that flesh out the picture. This chart looks at the relationship in unemployment from January to October of 2020. For the green line is the Canadian-born population. The dashed black line is the total population of Canada's labor force. And the dotted or dashed orange line are landed immigrants. And those could be people who arrived last week or 70 years ago. It doesn't matter. Anyone who was born outside of Canada. And as you can see, at the beginning of the recession, the unemployment rate of those groups was really quite close together, within about 0.5%. As the crisis first gathered momentum in March, April, and May, those unemployment rates just were completely coincident. But then over the last 6 months or so, we see quite a profound divergence between the unemployment rates of the Canadian-born versus the immigrant population. So that's the big picture. But of course, it gets a little bit more alarming when we start disaggregating that immigrant population. So here, I know this is a bit busy, but again, the green line is the same, the black line is the same, but now we're looking at the immigrant population disaggregated by how long people have been in Canada. The blue line are for immigrants who have been in Canada at least 10 years, and you can see that's hovering quite close to the population average. The yellow line are those who've been in Canada between 5 and 10 years, and then the gray line are immigrants who have been in Canada only up to 5 years. And you can see just how much higher the rate of unemployment is for that group. And again, it goes back to which sectors have been the most profoundly impacted by COVID, and which are the sectors where immigrants are generally employed. And so you can see a big gap there between Canadian-born unemployment rates and newcomer unemployment rates. And then, just to make matters even more challenging, this chart looks at the prime working age immigrants from 25 to 54 years old, and then looks at the difference in unemployment rate between male immigrants and female immigrants. And you can see a really enormous gap that has formed and enlarged during the COVID moment for that. So women immigrants have really faced a more profound level of disruption in terms of work. And I'm sure you've all heard the term before that has been circulating about this as a she-cession rather than a recession. In other words, a recession that is particularly impactful on Canadian women and immigrant women, again, especially. And then again, I apologize for the busyness of this chart, but this looks at, tries to get a sense of the difference between immigrants that are coming from North America and Europe, which are the orange and yellow lines towards the bottom of the chart, and then immigrants of color that are coming from primarily Latin America, Africa, and Asia. You can see immigrants coming from Asia, the green line, and Africa, the blue line, have much higher rates of unemployment through the recession than the total population, whereas immigrants coming from Europe and North America have actually lower. So what we're dealing with then is a set of intersecting issues that we have to take into consideration. And then there is the impact of the disease itself which is differentiated between populations of Canada. This is a report, this is a clip, I should say, from a report that came out just a few weeks ago, a very useful report from Statistics Canada, COVID-19 mortality rates across different kinds of neighborhoods in Canada. And I guess the first thing you can say about this chart is the tremendously more worrying picture from Quebec than the rest of Canada, which has seen much higher rates of mortality in general. Then you can see Ontario is also of concern, a little bit less so for Alberta and British Columbia, where mortality rates have been a bit lower. But the point of this chart is to compare for each of these regions those areas, those census tracts basically, or neighborhoods that have very low numbers of racialized people, or visible minorities as called in the census, versus those that have higher proportions of racialized people. And in Quebec, so you can see the mortality rate in areas with really tiny numbers of racialized people is about 35, 36 per 100,000. But then in areas that have more than 25% racialized populations, you're looking at figures that are about quadruple the earlier one. So it matters a lot where you live and the type of social category to which you belong. For Ontario, you can see that in those areas that have very low amounts of racialized populations, mortality rates have been about 8 per 100,000. And in areas with higher ratios of racialized populations, you can triple those figures. So again, this is evidence of the equity side of the COVID crisis. And maybe many of you have seen this already. It's just a clipping from the Toronto Star. They released an article in early July that showed these two maps juxtaposed one with another, which I think are incredibly instructive. One is the highest burden of COVID-19 across the neighborhoods of Metro Toronto, and the other is the percentage Black population across Metro Toronto. You can see they're not 100% exactly the same, but there is a very high correlation between those two things. And it's not, of course, because Black people I don't know, sneeze more often or don't wear masks or something. What it's about is the fact that such a high ratio of the Black population is at risk in terms of the work that they do. So they're in riskier sectors of the economy and also more crowding in the households. So those lead to much higher rates across that particular population. So now I'm going to turn to just the one thing I'm going to say about the international side of things, the global scale. What we can call an equity crisis in Canada, I think is better stated as a humanitarian crisis globally. And this is a very distinctive form of a crisis. So on the humanitarian side, what we're finding, and again, if we think about this from the point of view of migration, what we're finding across the world right now are vast numbers of stranded labor migrants in many countries. One particularly alarming case was, I think it's now just beginning to dissipate, but 2 months ago, there were over 250,000 people from India who were stranded in countries of the Gulf, where they no longer had their jobs, but yet they had no means to get back to India. And the Indian government was reluctant to take them back because it has been struggling with a rising rate of COVID, and they believe that might even become worse if all those 250,000 people came back to India. So people were stranded, and they've been in absolutely tragic kinds of waiting camps with really poor conditions. So that's just one example. Another example has been major food security issues among refugees. If you haven't yet read any stories of what's going on in Uganda, again, it's a tragic situation of malnourishment in large refugee camps in that country, and that's the case in many other countries in Africa and globally. Also, many migrants from the country of Venezuela that had found work in surrounding countries have found that those jobs have evaporated. You see lots of returns back to the desperate situation in Venezuela. And then the other point I would make at the global level is the absolutely tragic situation in the asylum system globally, which is now experiencing what you could call a crisis of immobility, which is completely different than what we were looking at, say, 5 years ago in 2015, when people talked about, the migration crisis and the number of people going to Europe and so forth. That was like 1 million, 2 million people on the move. Now the crisis is exactly the opposite, in the sense that so many countries have closed their borders, so many countries have suspended their asylum determination system. 70 countries by last count I heard from the UNHCR, and there have been increasing, really tragic examples of refoulement. Countries literally putting water cannons at their border and spraying people coming towards them just to deter migration. Of course, about the US-Mexico border being a case in point. So if we think about COVID and its impact on migration, then we have to think about it as a triple crisis that gives us at least 3 things to worry about: the disease itself, plus all of the various complications that go with it. I don't think we have even come close yet to addressing, for example, the issues of mental health that will be lingering for quite some time in the aftermath of the COVID situation. Then there's the economic hangover of unemployment and enormous debt levels that have been rising over this crisis. And we've got the added effect of inequality and lingering humanitarian issues. So we've really got a whole set of concerns on our hands. All right, what happens then? I'm going to move to the next part of the talk. What happens to Canadian temporary migration and permanent immigration during crises? And I'll speak very quickly about the recent history of those recessions in the 80s, the 90s, and the zeros, and then look at what's happened so far in this era of COVID. So if we look at these past 3 recessions, and let me start by thinking about their impact on permanent immigration, and then turn to temporary migration in a second. What happened was a changing response over time. In the 1980s recession, the Canadian government at that time, what we used to call CIC, concluded that it would be important to restrict immigration in order to not bring people into Canada when unemployment rates were high. And that was actually the lowest level of immigration that we've seen in the last 50 years. Canada restricted immigration to fewer than 100,000 people per year. I think in the lowest year was 83 or 84, where there were only 85,000 immigrants coming to Canada, which is really low by contemporary standards. So that was the response back in the 80s. Unemployment rises, reduce immigration targets, and reduce the number of people coming to Canada. In the recession of the 1990s, there was still a little bit of that, but not very much. In the 1990s, there was a different kind of philosophy that was activated by CIC, which was, if you shift immigration towards more towards economic class immigrants, then they would, even during a recession, find work, and it would still be a stimulus to the economy, even at a difficult time like a recession. So in the early 1990s, there was a much smaller drop in immigration targets, down to about 200,000 a year in the worst years of that particular recession. And that idea that immigration can be still a good thing even during a recession really dominated what happened during the global financial crisis of the last decade, when there was no drop whatsoever in targets for immigration in 2008, 9, 10, and 11, as that crisis began and then began to dissipate. So there's been this changing response. First, drop immigration by a lot, then maybe just by a little, and then not at all across these last 3 recessions. And in terms of temporary migration, I didn't bring it along, but I show folks often a graph of temporary migration through these last 3 recessions. No change. I mean, temporary migration has been increasing over time, and it has been completely unaffected by those last 3 recessions. But we've also learned that there's consequences for immigrants who arrive during recessions, and this has been corroborated, especially by research in the 1980s and in the 1990s. And it goes along with what I said a few minutes ago, and that is that immigrants and members of racialized groups face the most severe challenges in terms of getting work and keeping work. And that's because the sectors of the economy that have the highest immigrant and people of color in them tend to be the hardest hit during recessions. And arriving newcomers, we've seen it in these previous recessions, just as we're seeing it now, face a double challenge of being both the newest on the block, so to speak, and given Canadian immigration profiles, patterns, and so forth, they tend to have a high ratio of racialized individuals. And then you can add in the triple challenge for women immigrants that have suffered typically more during recessions. And what we've seen in the 1980s and 1990s is these disadvantages tended to produce scarring effects that have endured for years, sometimes even many years, on the cohorts of immigrants that arrived during the particularly difficult economic times of those recessions. And, you know, I'd like you to hold that thought a little, because that's what we have to try to see if we can mitigate against in the aftermath of this recession that we're seeing unfold in front of our eyes. And of course, the larger the incoming cohort, what we've seen in the past, the larger these impacts of scarring. And again, why is this? It's because immigrants mainly compete against other immigrants in the parts of the labor market where they congregate. So that lends itself to a really difficult challenge for newcomers. And then I've got the blue line at the bottom. Those have been the patterns in the past. It's possible that this recession will be different because the demographic situation of Canada has really evolved since the 1980s and 1990s. What's been happening is we've got a baby boom generation that is retiring out of the labor market. We've got a much smaller generation of children that are entering the labor market. And because of that particular dynamic, economic recovery in the form of employment might be quicker in the 2020s, and therefore the kinds of scarring effects that we've seen in the past might not be as pronounced. Well, we can certainly hope that they might not be as pronounced coming out of this recession. Okay, so what then, moving on to the next point, what has IRCC done during this recession as compared to the past? And it's really instructive to keep in mind that we're in a completely unique situation, one that none of us have lived long enough to see before. And that is that we've got this mix of a health crisis coupled with an economic crisis and also with border closures and with severe limits on the ability for government staff to do their job. Remember back in March, what happened, right? So at that time, the Minister of IRCC just simply issued an edict. Nobody can work in their office anymore. So you have 8,000 or so employees of IRCC that were sent home. And suddenly people had to recreate the work they do on their, I don't know, kitchen tables, wherever they could in their homes. And of course, they're working with highly sensitive information that involves lots of private details about people's lives. You can't just simply share that information. So it was an enormous challenge for IRCC to get itself up and working again with its staff at home. And there's a term that I'm sure most of you have heard before that many Canadian businesses speak about, which is they call something the COVID productivity tax. That's the drop in productivity that happens when you send your workforce home and try to get going again from that. So last I heard, I haven't really spoken for about a month to the senior executives of IRCC, but as of about a month ago, more than half of IRCC staff was still working from home, and I think that's still the case. And again, remember that this is particularly problematic with the kinds of in-person and paper-based elements of the immigration process. And perhaps the most obvious problem is with medical tests, right? So every immigrant that comes to Canada has to have medical tests and an authorization. That is an in-person thing, right? You literally have to have a doctor test your pulse, test your blood pressure, et cetera, et cetera. So that's been severely curtailed, and all the paper moving through the system has been curtailed. Now, IRCC has, of course, tried to fix this through mass digitization of records, through increasing use of digital formats for meetings. And in fact, what was it in, I think it was September, IRCC began the practice of so-called virtual landing. So they've been really trying to get into a new 21st century age on these things, but they're still inhibited, of course, by the fact that the borders closed. So they can only go so far in quotes, fixing the issues of mobility. So the impact then, the planned level of immigration for this year was 341,000. But given the restrictions on the border and in the capacity of IRCC to manage its tasks, we're going to see something in the order of 180, maybe 190,000 people come in 2020, which means we've got about 150,000 people missing from the expectation for this year. Gone a little more than half of what was expected, but almost half of the 2020 cohort is missing, so to speak. Now, given the state of the labor market, when we saw, especially in May, of 13.7% unemployment, maybe that's a good thing in the very short run, but of course we have to ask whether that's a good thing in the longer run. Also, what I really want to emphasize here is that in the past, like especially in the 1980s, the decision to reduce immigration during a recession was a conscious choice. It was a policy. There was a conversation and a decision made to have fewer immigrants. But in the 2020 situation, this has not been a conscious choice, but simply a reaction of IRCC to circumstances that it could not control. But then, of course, you can ask the question, well, wait a minute, how could you have 180,000 people arriving when you've got closed borders? And that's kind of an interesting situation. How has that happened? Who has been admitted over these last months of the COVID pandemic? And the first thing is IRCC has turned very decisively to what I think people are now increasingly calling inland immigration. That is upgrading people from a temporary residence visa to a permanent resident situation. And those transitions have been straightforward because they don't involve a person crossing a border, right? So you're taking someone who's already in Canada and giving them a new status by upgrading their visa to permanency. And that's typically done either through the many provincial nominee programs of Canada, through the Canadian Experience class, and it has also percolated into some other categories of our immigration system as well. It's also worth noting that although the IRB suspended its hearings for, I think, about 6 months, they are up and running again at reduced capacity, but we're beginning to see even some transitions of, humanitarian temporary visas into permanent residence. So that's the first category of people who have been able to migrate or immigrate to Canada. Secondly, when Canada announced its border closure back in March, there was an exception made for people who already had a letter of invitation. For people who had that before March the 18th, they were allowed to still come to Canada, come to the border, and execute their landing. So we've seen the folks who have been admitted over the last year have still been given the right to land. Now, by the way, many people are beginning to face deadlines and lapsed permission because they haven't had a chance yet to come to Canada for whatever reasons. But nevertheless, people who were authorized to come to Canada before March the 18th are still able to show up. And then on the temporary side, what Canada has done is put a lot of priority on individuals who are deemed to be essential to the Canadian economy. And those would include people in areas like food services, and the healthcare system and the transportation system have been three particularly high priority: drivers, nurses, other healthcare workers, agricultural workers, and so forth. Outside of these kind of prioritized categories, we've seen far fewer numbers coming. But it's also worth noting that IRCC is fully up and running again in terms of its admission process. So lots of letters of invitation are going out. for people to be coming in the near future if the border reopens. All right, so now let's take a quick look at what the profile of the people who are coming to Canada look like. And we've got wonderful data that are given to us every month by IRCC. They're available on the Open Canada portal. And I've been working with a couple of colleagues. I want to just quickly give a shout out to Andrew Griffith and Howard Ramos. The three of us have been working together on this. And so we've been gathering the data as they've been arriving every month on temporary residents, permanent residents, the transition from between those, and I'll also say something about the provincial scale of Ontario. So on the temporary side of things, I want to look very quickly at patterns in study, patterns in work visas, and patterns of asylum. And also note that IRCC has very kindly donated to the three of us, Andrew, Howard, and myself, data on how many people around the world are clicking on the information parts of their website to give us a sense of, is there still interest in Canada out there in the rest of the world? And what does that interest look like across the different categories? So let's start then with some charts on the student situation. By the way, as you heard from Debbie at the very beginning of this talk, you all have access to these slides. Nobody has to sort of get out their magnifying glass and look at what's happening here. You'll have a chance to look on your own computer at this at your leisure. But this just gives us a sense of student migration. And for most of these slides, I've used the beginning of 2018 through to September of 2020. And you can see typically the bulk of students arrives every year in August, just preparing for the new school term. And you can see a big spike in 2018, August, of 90,000 people, a big spike in 2019 of even more, over 110,000 people. And then that missing spike in 2020, August of 2020 only saw 40,000 arrive. And then a little bit of a delayed reaction. And you see a little bit more coming in September of this year, but nevertheless, way lower numbers than we've been seeing. And then the colors on this particular chart give a sense of where people are coming from. But maybe instead of going into the chart itself, let me just go to the next slide, which gives like as clear a sense as I can on what the source country patterns look like. And for this chart, what I've done is I've taken the main months of COVID, like April to September of 2020, and compared that to the same period in 2019. So it's a 6-month period in 2019 compared to a 6-month period in 2020. And you can see in total, back a year ago, in that 6-month period, Canada received 272,000 people. This year, only 172,000 people, so a big drop of 100,000 people. But that drop has been pretty consistent across the source countries. So the top 5 of a year ago are still the top 5 this year. The next 5 are pretty much the same as the next 5 last year, and so on. The only country that's fallen out of the situation of the top 15 countries over this past year has been Taiwan. And really, you have to ask yourself, why, given Taiwan's enormous success in the treatment of COVID, why would anyone migrate from Taiwan to Canada right now? That'd be like a really good question. And of course, that's not much happening. And the only country that's entered the top 15 from last year to this year is Hong Kong. And again, you can think of that, I think, as an aftermath of the political issues that are happening in Hong Kong. So that kind of makes sense too. Otherwise, really, the distribution of source countries this year versus last year is about the same. And again, like I mentioned, we also very happily from IRCC have received data on how many people are looking to migrate to Canada for study reasons. And the numbers are pretty high, right? So you're looking at about 90,000 on average per month clicks on that website. And the numbers for 2020 are a little bit lower than they were in 2019 and 2018, but not much. So there's still a lot of interest out there. I think you can project from this particular chart the point that we're probably going to see a quick rebound once the borders reopen in terms of student migration to Canada. All right, then, I'm sorry, kind of a busy chart, but this is looking at labor migration to Canada. And as I'm sure all of you know, the big categories are temporary foreign workers. Those are in the blue shades. And the green shades are people who are coming through the International Mobility Program. So that's the general picture. But I think, again, a more useful way of looking at this might be in this particular table. And this tells you the number who came in the big categories of temporary foreign workers and International Mobility Program, and also study permits. In this case, it's a 5-month period. By the way, why aren't I using September for this table? And the simple reason is the September data aren't up yet. So for temporary foreign workers and international mobility folks, we only have data until August. And so I've compared the 5 months of 2019, April to August, with the 5 months of 2020. And then the last column tells you what's the ratio of 2020 compared to 2019. And as you can see, the one most resilient category has been the agricultural visas under the temporary foreign worker program. And basically Canada had the same number coming in 2020 as 2019. And this was very much a prioritized area for temporary migration to ensure food security across Canada. So Canada actually dispatched special aircraft to Central America, to Mexico and so forth, to make sure that there would be agricultural workers coming to the country. The other most resilient category has been under the International Mobility Program, the category broadly labeled Canadian interests. And again, you see Canada is doing what it considers to be in its best interest in terms of the temporary migration numbers that are coming in. Whereas other categories, for example, the very top one, caregivers, have just plummeted by 2/3 over this year compared to the same time period last year. Again, though, the level of interest in getting temporary work visas in Canada is still pretty robust. We're still getting, as of October this year, over 80,000 people that have been clicking on the how-to side of the Canadian website. So again, I think there's quite a bit of resilience out there in terms of interest in Canada. Okay, then moving on to asylum. Unfortunately, the data here only go back to the beginning of 2019 rather than 2018. But this chart gives you a sense of how many people have been coming for the purposes of asylum to Canada. The yellow line at the top is just the total number that have come in. And what you can see through 2019, generally speaking, about 5,000 people made an asylum claim per month in Canada. And then it's as obvious as can be, that number has plummeted. Now it's around about 1,200 per month, so that's plummeted by like 75% over the COVID crisis. And then the bars at the bottom are for just the top 25 countries, but for those countries, IRCC very helpfully lets us know the claim type, those who came via an airport versus those who came to make their claim at a border, versus those who made an inland claim. And again, you can see a very clear pattern here. Until COVID, there was not a huge fraction, but yet somewhere in the order of about 10, 15% were making their claim at an airport, and that's just completely dried up during the COVID era. Almost nobody now is making a claim at an airport. Border claims have been reasonably significant in the past, and they become a very small component of the number of asylum claims that are made in Canada now. The bulk of claims made in Canada now are inland claims. So that's been a bit of well, not a bit, that's been a pretty significant change over the last several months. And this chart just gives you a sense of how that's played out with the top 25 source countries. And what I'm looking at here is all of 2019 versus the first 9 months of 2020. And you can see basically much lower numbers across countries, but there have been some that have been a little more resilient than others. Haiti, for example, the drop in the number of claims has been much smaller than across most countries, whereas Nigeria would be an example of a country that's had a very profound drop in numbers. And it has to do with again, inland versus airport versus border type crossings. Okay, so that's the story on what's happening with Canada's temporary migration. Now let's take a minute to look at what's happening on the permanent resident side. So quickly, I'll look at admissions by category, then by where people are coming from, and then at this very crucial issue of the transition between temporary and permanent residents to Canada. So this gives you the big picture by category. The shades of blue are the economic category. So the darkest blue are Canadian experience class, excuse me, federal skilled workers, federal skilled trades, and that would also include Quebec's skilled worker program. Then the yellow color is for family reunification, and the green color are refugees. And as you can see, there's been kind of an annual pattern. No surprise, more people want to come to Canada in the summer months than in the winter months. That doesn't take a genius to figure out that pattern. But you can see just the absolute drop that happens in March and April of 2020 when all IRCC staff were sent home, the borders are closed. The average number coming per month until that point was about 27,000. And then the month of April was the lowest recorded in at least 50 years. At only 4,100 in that particular month. And then you can see a kind of sputtering restart, right? So the numbers begin to get back something closer to normal by June, but then the recovery doesn't really last, and numbers go down again in July and August, up a little bit again in September, but obviously we're nowhere near a full recovery of the immigration system at this point. And then you might ask, well, what about this ratio between economic versus other forms of permanent immigration during COVID? And I have a slide for you, which is this table. I'll take a minute to just explain what's going on in this table. The yellow column, well, first of all, the rows are the different categories, right? So the three economic categories of federal selected people, provincially selected people, and then other. Then family and refugee, and then the total number. And as I said, about 27,000 people come in any given month between January of 2018 and February of 2020. And you can see the distribution of, about 9,000 come through federal skilled or Quebec skilled programs, about 5,000 through other provinces, a couple thousand of other economic immigrants come in, about 7,000 family folks, about 4,000 refugees. That's the norm for that period. Then for each of these months, it's just what's that month's figure in that category as an index of the usual, right? So basically you can see numbers really fell. If you look at the bottom row, numbers fell by about a third. In March, and then they fell to their lowest level ever in April, down by 85% to only 15% of normal. Then you see this recovery towards June, and then the sputtering recovery, as I call it, afterward. And the final green column gives you the average from April to September of 2020. And on average, what we've seen is only 45% of normal immigration. But here's the key to this particular chart. Notice the first two rows are Canada's main economic programs. The recovery there has been a little more robust. We've been seeing 51% or 56% of federal or provincially selected skilled migrants, as opposed to only less than 40% recovery in family reunification and only a 36% recovery across those 6 months of refugee immigrants. So Canada has obviously put a premium over these last 6 months on the economic side of things. I'm not going to go through this one. You can, look at it at your leisure at home or in your office or wherever you are. But this looks at permanent resident admissions by world region of origin monthly from 2018 to 2020. And I guess the big picture for me is the changes are more subtle than dramatic. It's not as though this moment has become one of a complete reinvention of where immigrants are coming from to Canada. Mostly there have been, as I say, very subtle changes in that. And that's, I'll leave it at that. You can also see that by just this table, which compares top 20 countries April to September of last year versus top 20 countries, April to September of this year. There are some changes, but they're not huge, especially at the top end. You can see India, then China, then the Philippines, and a little bit of shifting of position, not very much. In the next three, United States moves up a couple of positions, Nigeria moves down a couple of positions, Syria moves down a little bit more. But anyway, the point is, there hasn't been a huge change in the pattern of sources of immigrants coming into Canada, given just how disruptive COVID has been. I think that the resilience of this is the big story, not the change. Okay, then in terms of refugee admissions, just to give you a sense of that, what we're seeing is a kind of a shifting of positions during COVID here. This has been a little more significant, right? So typically the blue line, which are resettled refugees, and that would include privately sponsored plus government assisted plus blended visa folks all together in one lump. That's the blue line, and that's typically been bigger than the orange line, which are protected persons in Canada, so folks who have come through the asylum system, the IRB, and so on. The blue line has typically been higher, but during COVID, those positions have been reversed, and Canada has received relatively fewer resettled refugees than normal. In fact, if you think about it, the average has been about 2,500 per month, and now it's about 500 per month. There's been like an 80% drop in resettled refugees, whereas the number of protected persons in Canada has bounced around, but it's closer to the norm than the situation of resettled refugees. And then lastly, on the federal side of things is temporary to permanent residence transitions. What does that look like? And of course, this is immigration based on previous temporary resident decisions, or what I've been calling inland immigration. Again, this is a bit of a busy graph, but maybe the green line is the only thing you really need to look at here. And the green line is the ratio of people, and the scale is on the right side of the chart rather than the left, ranges from 0% to 80. The green line is the ratio of people who have been granted permanent residence who already had a temporary visa to be in Canada. And in general, that ratio has been about 30%. Across 2018 and 19. But during COVID, for a while, it jumped up to 60, 70% for a few months. And then it's kind of settled back down to the norm again. So what that tells you is in the early phase of COVID, what Canada did was really aggressively turn to the existing temporary resident population to convert visas into permanent residents so people didn't have to cross a border. But that hasn't been fully sustained, that particular strategy, over the last couple of months. Okay, then one last bit of data before moving into a conclusion. Before moving into where we're at in terms of the plan and then a conclusion, is to just give a quick sense of what's been happening in Ontario. So first, Ontario in context, then permanent residents, and then a quick focus on refugees coming into Ontario. And I'm just looking at the permanent resident side of things here. So this gives you a sense of where Ontario sits relative to other provinces in Canada and through the last few years, and of course, historically as well. Ontario has been the big game in town in terms of where immigrants are choosing to settle in Canada. You can see, generally speaking, Ontario has been receiving between 10 and 12,000 people per month. And then you can see the big drop off in April and then recovery thereafter. Basically, Ontario has been pretty much holding its share of the immigrant population coming to Canada. Then we have three other provinces that are all jockeying for second place at any given point in time. And then I didn't put the other provinces in Canada, but they're very low with respect to the big four. And let's then look inside those categories at what's happened in Ontario. And here I'm looking at the big picture of economic versus family versus refugees. And what you see is, so the economic side of things, typically about 6,000 to 7,000 per month coming into Ontario. Then the big drop, then, right back to normal almost by June. And then that hasn't been sustained. So we're seeing again July, August, and September, relatively low numbers on that. Family numbers, typically around 3,000 to 4,000 per month. Those really dropped a lot, and they've been slowly recovering. And there you can just see like an incremental upward shift through each month between April and September, to the point where family numbers are in September the same as economic numbers for Ontario. And then on the refugee side, generally speaking, about 2,000 per month, which has then dropped dramatically, but it's also been recovering a little bit more than might be expected. And so we actually see in September of this year something which is unusual, and that is you have almost the same number of economic, family, and refugee immigrants admitted to Ontario in the same month. Then looking, disaggregating further, and again, I don't expect you to appreciate what's on this graph in 10 seconds, but you can look at it at your own leisure. What's been happening if you get inside that economic category? And basically, what we saw, that big spike that happened in June of this year was primarily based on the Canadian Experience program. For whatever reason, that program really lit up the charts, so to speak, in June of this year, and then it's fallen back to quite low levels, and a little bit of a bump in skilled workers as well. But you just get a sense there of what are the important subcategories of the economic system. And then finally, you'll probably appreciate my last data slide is looking at refugee admissions to Ontario. And there the story is really clear. What's happened is the blue, orange, and gray lines are all based on resettled refugee folks, and those numbers have been really tiny since COVID, but the protected persons in Canada numbers are right back to normal in Ontario. So you're looking at about 1,200 per month coming in the last couple of months. Okay, so now getting to the very end, and I appreciate your patience. I've been really throwing a lot of information at you. But again, hopefully you can get the slide set, and if this information is important to you and your work, you can take longer to process it on your own. I want to quickly deal with the new levels plan that was introduced by Minister Mendicino, and then the challenges of that plan to end off this presentation. So first, a couple of thoughts on background realities. It's never been a question of if immigration would recover in Canada, but a question of when, simply because there's still enormous humanitarian needs around the globe. In fact, they're arguably higher now than they've ever been before, given the global immobility crisis. And also, Canada's demographic situation is not changing. We are a low fertility country. So therefore, Canada is going to get back to high levels of immigration. And as I say, it's not a question of if that's going to happen, but when. And now we learned a few weeks ago what that's going to look like. And the when is going to be pretty much immediately. So Minister Mendicino is now projecting 400,000 immigrants in the coming year, then a tiny bit more in each year thereafter. And now the question that we can face is, first of all, how is this going to be achieved, and what are the consequences? And for that, I want to remind you of what I started with, and issues of the equity crisis side of COVID. What's this going to look like from that vantage point? So first, just to give you a sense of numbers, the chart on, well, both of the charts are the same. It's just disaggregating the information in different ways. Maybe let's focus on the chart on the left here, which is the targets of well, the actual number of immigrants who came between 2015 and 2019, the number that have come so far in 2020, within this imaginary missing cohort chunk, and then the expected numbers for 2021 through 2023. And so you can see that there's the expected instant resumption of immigration, and starting right in the coming year, and in fact at even a little bit higher levels than we've seen in the recent past. And then the chart on the right disaggregates this by categories, and what you can see is there's an expected small lift in the number of refugees, small increase again in the number of family immigrants, and quite a profound increase projected in the number of economic class immigrants that are expected to come to Canada in the next few years. Okay, so will this happen? Well, there's some positive factors that suggest that it can happen. One is that IRCC is typically really efficient. When it takes on a target, generally speaking, it meets that target. It's been one of Canada's most efficient ministries across the whole government of Canada. Secondly, as I showed in the couple of clips from the website of IRCC, there's still a lot of global interest in Canada. Tens of thousands of people per month are still, in fact, hundreds of thousands of people actually per month are still looking at the Canadian website and trying to get a sense of it. Also, we have quite favorable general public views and employer views on the resumption of immigration to Canada. I wish I could take longer on this. There's a bit of mixing in those views, but generally the Canadian public is okay with resumed immigration. And already IRCC has been throwing out letters of invitation to people across the world. So those facts suggest that we can get back to normal and even more than normal levels quite quickly. But in the short term, there's still some challenges. First of all, when is the border going to open again? Certainly not day one of 2021. I don't expect that in 7 weeks, whatever it is, 6 weeks time, 5 weeks maybe, whatever it is, the border will instantly reopen. I'm expecting we aren't going to see that border reopening until probably middle of the way through 2021, and that's going to inhibit Canada's ability to reach its targets in that year. Also, I think people might be underestimating the fragility of the global transportation system. There's the expectation that many of the world's airlines are going to fail. It might actually be a little more difficult and expensive to get to Canada for immigrants coming forward. And this gets us back to the equity crisis issue that I started the presentation with. If people come and find it difficult to find work and send that information back to other prospective immigrants, there might be, there might be a greater reluctance to come to Canada right now among newcomers. We'll see whether that transpires. Okay, and this is just a bit of evidence on the point I made about Canadian attitudes being quite positive. I don't have time to dwell on this, but this is the Environics survey that was just released in October of this year. And you can see that Canadians disagree with the statement that immigration levels are too high, and they very much agree with the statement that the economic impact of immigration to Canada is positive. So this gives the Minister Mendicino and the Canadian government a lot of scope in terms of making policy decisions on this front. Okay, again, so how is Canada going to achieve the number that it lays out, especially in the coming year of 2021? One thing I expect to see is an even more aggressive reaching out to potential inland immigrants, students, temporary foreign workers, asylum seekers. I could see that there being a real effort to fix the IRB, get decisions more quickly, and maybe even some effort to just let asylum seekers stay, even if they don't go through the IRB process, as potential immigrants to Canada. And really, I think we can even ask the question of whether Canada might begin to consider the idea of an amnesty for irregular migrants that are in Canada, just to meet those targets for 2021. I'm going to come back to that point in a minute, because I think it's very important. I also expect to see some selective easing of border restrictions. This is part, I'd love to talk about this longer if we want to talk about global issues in the discussion. What we're seeing is a huge effort by many countries around the world in what is increasingly being called health proofing of borders. But again, I'd love to talk about that longer, but I'll just leave it at that for now. After the borders reopen, I expect Canada might resort to maybe lowering the comprehensive ranking system score for economic immigrants, at least temporarily, to bring larger numbers in as quickly as possible. But in the long run, numbers are going to rise as the economy rebounds and the demographic issues kick in and so forth. But what are the consequences? Well, again, remember that Canada is stimulating its economy more than most other countries, more than almost any other country right now. And once we see that fiscal stimulus begin to end, I would expect that to be sometime around the middle of next year, we're going to see what the real rate of unemployment in Canada is. And I'm thinking that's going to be somewhere between 1.5 and 2 million people. And what that means is that the 2021 plan by Minister Mendicino is going to add about 250,000 working age adults to a labor force where there's still a huge rate of unemployment. Now, some of those people will be, upgraded temporary residents to permanent, but this is an enormously challenging kind of a prospect. Integration issues are going to become absolutely critical, and those are the obvious ones that we've known about for years and years. Access to the labor market, how do immigrants compete for jobs when there's maybe as many as 2 million Canadians unemployed? Credentialization issues are going to be at least as important as ever, maybe even more important than ever. Opportunities for entrepreneurship are going to be vital for that really large group of people who are going to be arriving. And this leads to, of course, the point that is that your sector, I think, is going to be challenged as much as ever in this next 2-3 year period. And that, raises the important question of whether Ottawa is going to enter a period of fiscal restraint and reduce the amount of money that might be flowing to your agencies at a time when you need it perhaps more than ever. So that's a really important thing to be thinking about. And I just want to end this presentation, and I know it's been a long one, and I really appreciate your patience, end with a sense of, what could be done if one wants to take a progressive view these days. One thing is, I think that the settlement services sector, this is like the best moment ever to make the argument for expanding the eligibility for immigration services to include temporary residents, since the Canadian government is going to be so dedicated to having these transitions from temporary to permanent residence. More than ever before, the argument can be made, we really need to give services to temporary residents since so many of them are now going to be coming to Canada to stay. Second, I'm sure you already have heard about the Guardian Angels program, the idea that temporary residents who have worked in healthcare related fields can now be upgraded to permanent residents. I think that this is a golden moment to argue for the expansion of this program to include all temporary residents who have found work. If Canada needs to upgrade them, let's do it now. This is a moment when I think we can push for the upgrade of so-called unskilled temporary residents to permanent residency in a way that I think wasn't really available to us before. And finally, as I said before, I think this is a moment when people who are in advocacy roles, people who are on the progressive side of the equation, have an opportunity to make an argument for the regularization of undocumented residents, especially those who have found work in Canada. It just seems like if we need to meet those targets for 2021, 2022, this is about the most opportune moment ever for that particular initiative. Okay, that's it. I have certainly spoken long enough. I'm just going to come back out of screen sharing, and I'm going to turn it back over again to Debbie.
Thank you, Dan. What a rich and informative presentation. I could feel the energy of our data heads in the audience just wanting to get their hands on all this data. So thank you, Dan. There are a number of questions about that. Yes, we will be sending you the slides that Dan used in his presentation. Dan, we have a number of questions that folks had sent ahead of time, and there's just so much to start the conversation. I want to encourage our audience members to write your comments, not only questions, but write your comments in the question box. But Dan, there is one, we could take about 3 or 4 minutes and just explain to us a bit about the international mobility program. Who are the people who are usually accessing that program? You also talked a bit about Canada's interest in that program. Will you also comment on that, please?
Sure. So Canada receives, or admits, I guess is a better term, people who come here for temporary work under 2 broad umbrella programs. And one of those is the Temporary Foreign Worker Program, and the other is the International Mobility Program. And the big difference between those two programs is individual people apply under the International Mobility Program versus employers apply to bring in workers under the Temporary Foreign Worker Program. So for example, an employer, a farmer, would apply to bring in farm labor. And so these aren't like individuals. One of our most important source countries for farm labor is Mexico. Individual Mexicans don't send an application to IRCC to say, I want to be a farm worker in Canada. It's the other way around. It's the farmer that recruits. So that's on the temporary foreign worker side. Then on the international mobility side, that's a case where individuals apply. And so, and again, within that big umbrella, there's several different subcategories, and one of those is called Canadian interests. And this is, well, it can be whatever Canada seems to think it's in its interest, but this would include things like Canada's very keen to see young people come here. So Canada has reciprocal agreements, I think with something like 50 different countries. Someone can correct me on that number, but it's at least 50 different countries for youth exchange type programs, right? So a young, say, Irish woman can make an application to come to Canada to do like what's called a working holiday. And they would come here for up to 2 years and work at any job that they want to find. So it's the individual who's applying rather than the employer who's applying. Now, also under Canadian interests are things like the high-tech workers. You know, we've had a lot of temporary workers come to Canada for to get jobs in things like Microsoft and the movie industry. You know, the people who do the special effects and all that kind of stuff. Those kind of jobs are considered in Canada's interest because it propels the high-tech economy and so forth. So, other things that are in the International Mobility Program, intercorporate transfers, right? So Coca-Cola, whatever, says, hey, we're going to dispatch this person to go work in Toronto from Atlanta or whatever the case may be. That's also in that International Mobility Program. So all of that stuff is collected up. Sorry, I hope that wasn't too long, Debbie, but I just wanted to give people a sense of those pathways into the Canadian workforce.
No, that was very helpful. There are a number of comments and questions around work and job losses, and one comment is that what we're calling temporary job losses during the pandemic can actually be permanent.
Oh, absolutely. Yep.
So what should we as a sector and government, province and the feds, be looking at in terms of reskilling or upskilling newcomers who are disproportionately impacted? So we're talking about women, immigrant, refugee, and migrant women. We're talking about racialized immigrant and immigrant folks, but especially women. So what should we be taught? What's the conversation that should be happening now?
Well, you know, this is the moment that this has to go online, right? So first of all, the issues you identified are absolutely central, and it's both. You know, I'm just repeating what you just said, but just to agree with everything you said, reskilling is vital, and one has to be aware of the equity impacts of a recession, and really specifically target. As you said, people of color and especially women of color in this moment, because they're the ones who have faced the brunt of this recession, and they're the ones who are, you know, they were the ones who were let go of first. So that's clear. So just agreeing with everything you said. But now the question becomes, how do you solve the riddle? What's the answer to the riddle? And there, obviously, we have to move to digital technologies, because we can't be having people face-to-face in classrooms in the same way that we had in the past. So this move, now in British Columbia, I don't know, I do know that there are parallel programs in Ontario. I don't know what they're called. I don't know enough about your jurisdiction. But in British Columbia, we have a program called FAST, which is run by the Immigrant Employment Council of BC. Which is a digitally based program for people to prove their skills, right? So I'm going to use just, if I wasn't an academic, I would be a carpenter. That's my family history. I'll just use carpentry as my example. So in the FAST program, people have like a whole bunch of online modules of learning and then testing modules to prove the skills they have as carpenters, and they have like 15 different skill areas for a carpenter to prove, and they can get a certificate all online, and that's like a really important thing. Now that's probably not the best pathway for the racialized women that you're talking about, Debbie, but it's just an example that came to my head very quickly because it's in my own family history. But I think those kinds of programs are absolutely vital. But there's a second thing, and you know all about this, and I'm sure the folks that are on this this conversation know all about this. At least as much energy has to be made to approaching employers and talking to employers about their assumptions, their stereotypes, their lack of knowledge of the skill sets of newcomers. So like there's obviously a two-pronged kind of approach needed here, right? There's the helping the newcomers, and there's the awareness raising among employers that has to happen at the same time. So that's where that's where I would encourage people to think about.
Oh, absolutely. And I know that we have colleagues from organizations like TRIAC, the Toronto and Region Immigrant Employment Council, and WEST, the World Education Services, who deals with international credentials online, so on the call. So if you want to add some of your initiatives in the chat box so people will know, that will be great. There is a comment that says economic immigrants come with their savings with the assumption that they will settle and find jobs. If jobs aren't there, would you think that this will bring consequences in terms of people accessing social welfare earlier and in higher numbers? And what would be the impact for this on the Canadian economy? In your conversations with our colleagues at IRCC, then, has there been any sort of conversations around the fact that we're looking at bringing in 400,000 people beginning in 2021? I know OCASI as a sector rep is very much behind those higher numbers, but what are the negative implications of this?
Yeah, so in my conversations with IRCC, I would say that IRCC folks are very much, how can I put it, are very much in the philosophy that immigration is good for the Canadian economy. So it's like a long-term view, and I don't think that they have paid a huge amount of attention to the short-term challenges that people are going to face when, as I said before, we're going to be adding about 250,000 working age people to a labor force where there might be as many as 2 million unemployed people. In the long run, this is going to work out, right? In the long run, the demographic situation of Canada is very much on the side of being able to accommodate large numbers of newcomers. But in the short run, we're talking 2021, 2022, even 2023. This is going to be enormously challenging. And your questioners, I think, are absolutely right. People are going to come, as everyone, I'm sure, who's in this conversation knows, there's a requirement that immigrants come to Canada with enough money to fund themselves for approximately 6 months. That's the intent of the policy. But what if it takes longer than 6 months to get a job? And in that situation, right, where 200,000 plus people are added to an already a difficult labor market, I think we're going to see a lot more people take more than 6 months to get their first job. So I can see people running out of their savings in larger numbers than we have seen since, I would say, the 1990s. This is going to have big impacts, and I think your questioners have already noted this. This is going to have big impacts on provincial social assistance systems, right? Because Ottawa makes the choice of who comes in, but it's provinces that supply social assistance, except, of course, for government-assisted refugees. And we're going to see quite substantial demand for that social assistance, in my opinion, if these numbers are reached in the short term. In the long term, that will even itself out and we'll be back to something like normal. But in the short term, we ought to prepare for this. And I think you will have more people knocking on your doors than ever to help people understand what their options are. to help people figure out how to get access to work and so forth. I think you're going to be busier than ever over these next months. And again, I do worry a little bit about the prospect of fiscal restraint.
Yes.
And you may find yourselves in a very I'll just simply use the word horrible situation of more need and less money at the same time. So that's something to really guard against.
Absolutely. I'm actually, earlier this week, I was presenting at standing committee looking at the impact of COVID and immigration and the settlement sector. And that was one of the concerns we flagged, that at a time when we will be seeing increased needs, especially around employment needs support, but also we know that in economic downturns, especially with women, who tend to be the last one in the families to access settlement services, they may be, that's the time that they're laid off, that they're looking for reskilling, may need language training and those kinds of things. And it may be the time when we're beginning to see cutbacks. I'm certainly hoping our IRCC colleagues who are on this call are listening. It is probably one of our key priority advocacy issues on the service program side. Of our conversations with the federal government, but provincially as well. In Ontario, the Ontario government says it spent about $75 million in the last 12 months in immigrant settlement. That's interesting. I was saying to my colleagues, that's down from the 100 million that 2-3 years ago the province was saying that they were spending. So I'm wondering if the elimination of the ministry resulted in a $25 million saving. That's a question that we'll be coming to the provincial government with. I know that some of our colleagues from the Ontario Ministry of Community and Social Services and the Ministry of Labour and Skills Development, who are responsible for migration in Ontario, are on the call as well. So those are conversations that we're certainly wanting to have with you. I know the sector folks are very much concerned, especially not knowing what the budget for Ontario will look like in 2021 as contracts come to an end in March, on March 31st of next year. There are lots of questions and comments about regularization of status, beginning with folks even before who sent in their questions in advance. And you mentioned one of the programs that's been put in place since COVID, the Guardian Angel programs. The conversation started in Quebec with those who had claimed asylum, others who were here on temporary work permits, working in our hospitals and long-term care homes. There has been a push, Dan, as you have recommended in your remarks as well, to expand that program. We also know that earlier they had put in place, the federal government had put in place a very tiny program for agricultural workers. The conditions were so steep. We were saying that we didn't think anybody would qualify. And we know that there's also, over the last couple of years, I believe, a small 500 number construction program for construction workers in Toronto between the federal government and the Canadian Labour Congress. So we've seen all of these regularization type programs. We absolutely agree with you that the time is ripe for us to be pushing for a broader regularization program here in Canada. Any comments? I know there are organizations like the Migrant Workers Network, OCASI, of course, and I know the other umbrella organizations across the country are wanting to have a conversation about how do we ramp up our campaign for a regularization program right now. So Madeline, your question is absolutely timely in terms of how do we harness the energy of the settlement sector to push for regularization. Dan, any comments, any learnings from past
thanks, Debbie. I want to say one thing. I will get to that, but I want to say one thing before that, and I'll just mention that we in British Columbia have been looking upon the Ontario government's investment in immigration with a great deal of envy over the last decade. And now, of course, that's been to some extent dismantled. But even still, your provincial government is putting a lot more energy and effort and enthusiasm into issues of immigration than our provincial government is doing. I'm working with a couple of other friends. We're trying to work through back channel conversations now that Premier Horgan is choosing a cabinet. We're pleading, please have a ministry for immigration. Immigration is it's the how can I put it?
The driver of our
policy. immigration policy sets the agenda for what Canada is going to be in the future.
Here, here.
And for provinces to just take a spectator view on that, I think is really unwise and unhelpful. So I think, signaling the provincial interest by having a dedicated ministry to immigration issues is, an absolutely first item of first importance, I would say. And then following that up with real interest and budget and so forth is also very important. So that's a side point, but I wanted to raise it since you had talked about.
Oh, absolutely. Minister Smith and Naughton would love to hear you say that about Ontario. But yes,
well, it's true. I say it because it's true. But now you asked the question about how would we get to this idea of advocating for regularization program? And here I think the onus is on the advocacy sector to convince first the public and then the government. If you just try to convince the government, I don't think that's going to be as fruitful a kind of endeavor. I think this means talking to the media, getting the public to understand. And by the way, part of the problem of this, of course, is we got no numbers, right? We know there's lots of undocumented people in Canada, but we don't know how many. We don't know where they are. There's such a dearth of data, but we know that undocumented folks are critical for certain industries in Canada. The more we can make those points real, the more we can talk about real individuals, real families that are making a contribution to Canada, the more we can get that word out to the public. And policy reflects public interest, right?
absolutely.
If IRCC thinks that the public wants this to happen, there's a much higher chance that it'll happen. So all I'm trying to say here is don't just think of having an advocacy strategy that talks to politicians or that talks to people in the bureaucracy. That's not going to be enough, because this is a pretty big change of policy that we're talking about here. And it's only going to be undertaken, I think, when there's a larger public understanding and acceptance of the rationale for this. Oh, and by the way, another thing that is, I don't like to think of policy happening on the basis of fear, but I think this is a pertinent point. For public health reasons, you want everybody included, right? The pandemic teaches us that when people are excluded from the public health equation, that creates a real problem. And I don't want to be like fear-mongering about undocumented people and so forth, but I think that's another rationale that has to be brought into the picture to make this argument work.
Absolutely, and I think with that argument, municipalities have an important, and towns have a really important role to play here, because people settle locally. I know here in the city of Toronto, that's one of our biggest concerns at the municipal level, right? As public health initiatives are put in place, as we're looking around issues of housing and income support, how do we ensure that all who are resident in Toronto have access regardless of immigration status? And so I do think that is certainly one approach that municipalities should be taking, is to speak to the provinces and to the federal government to say, look, this is a time to regularize people's status, or at least to open up so they have access to all income supports. There are some questions and comments in our box here that talks about that international students not being able to work, or falling out, having their study permits expired and being here in Canada with no access to income. How can they be supported? And that is an ongoing issue that we have. Folks who've been here for years and undocumented, and then the informal economy shutting down. So there are critical issues that's impacting on people's lives that all levels of government, I think, needs to address. But I absolutely agree with you. I think the regularization fight has to be a public fight, not only in terms of trying to convince politicians, but also getting who we call Canadians, the public, on site. There is a very personal questions from Sherry. Sherry, will you please contact the South Asian Legal Clinic of Ontario, SALCO? Although they serve South Asian communities, they're very much open to giving advice. So you can contact them about the case that you referenced here about the international student who is looking for support in terms of permanent residency. That's SALCO. Dan, you had mentioned an employment program in BC. Folks would like you to say what the acronym is again.
FAST, F-A-S-T, easy. Yeah, so if you want to do a little search on it, just do IEC of BC, which is, very much modeled on the TRIAC that you folks invented. So it's a parallel organization. And I think one of their most productive interventions in this area has been, they were, I think, one of the first to acknowledge that the future of credentialization is digital. And having these kinds of very high quality digital programs that can enable people to demonstrate the fact that they've got the skills. So, just having a certificate is not enough for employers often, right? They want to believe that you actually have the skills. So demonstrating it through passing these kinds of tests on these digital systems, at least in BC, has been a useful way of moving forward on these particular issues. And I think they've now got dozens of specific professions in their system. And I think it's an up and coming technology.
Very, very, very good. And I think the link has just been placed in your question box for IECBC and the program FAST. Sherry, given that the woman is in Manitoba, I would suggest that yes, SALCO may point you in the right direction, but FCJ Refugee Center, who works with women, especially women asylum seekers, who is also on this call, they will also be able to have you point you in the right direction. Let's Dan, can you talk a bit some more about the borders? You talked about a new regime called the hygiene, the health hygiene, the...
Yes, I didn't have a chance to go through it yet.
So talk about that, but talk about it in terms of what and how and who, what are the implications for various groups of people? For example, racialized immigrants.
Yeah, so, I'm involved in a number of international conversations where I get to hear senior migration officials from different countries have a conversation together. It's very instructive. It's a great learning experience for me. And one of the things that they're talking about is how can they make borders smarter in this sense. So think about it. Like right now, we know that the pandemic is absolutely raging in the United States. But the simple fact of the matter is, what's the infection rate, the active infection rate of people that have COVID in the United States? 1% of the population, possibly 2%, of people who are like actively contagious. So that means that we would have no trouble if we could distinguish between those who present a risk versus those who don't. We would have no trouble admitting 98% of the US population through the Canadian border if we knew which 98% was healthy and which 2% were unhealthy. So that's the operative principle that governments around the world are thinking about, how to health-proof borders. Now, what they're doing so far is a far cry from what needs to be done, and that's the term hygiene theater. So hygiene theater is the idea that they point a little device at your forehead and they take your temperature. Sometimes the device works, sometimes it doesn't. But it's a useless kind of an intervention because, of course, you might have taken an aspirin or an Advil or a Tylenol, which has reduced your fever, and they can't detect you anymore as being ill. So it's theater. It's something that is designed to make it look like the border is actually secure when it really isn't. And so what governments around the world are trying to think through is what technologies could they bring in that will actually distinguish between people who are ill and people who are healthy, in the same way that after 9/11, governments brought in a whole bunch of technologies to try to distinguish between people who might present a security risk versus those who don't. And as you just said, Debbie, these kinds of initiatives often have very profound racialized consequences in terms of profiling, right? So what governments are looking at is ways to profile people such that they can more quickly distinguish between the healthy and the at-risk populations. And to what extent are those profiles going to be like overlapping with issues of race? Well, we can predict it will probably be there. It's hard to know how much it will be, but it's quite possible that it will be there. So that's a little bit more on that issue. I'm happy to talk further if you want, but I think that's maybe enough for that sense. All I can say is expect billions of dollars of investment in border technologies to try to have health-proof borders in the next generation. Just like I'm told, actually, the investment in borders after 9/11 was $1 trillion in that. And we've all seen what that means in terms of delays and all the other kinds of things. Expect another round of that on the healthcare side of the world.
Yeah, and all of the negative fallout from all of that for particular groups of people. You're absolutely right. Let's turn our attention to smaller centers. One of our colleagues is saying most newcomers settle in large urban areas. Is there an opportunity to assist in settlement in smaller cities, which will have shortages in terms of labor and talent? So we know that the government have implemented the rural and northern pilot program. They've announced a new municipal nominee program that hasn't rolled out yet. And of course, I believe we're in our 3rd year, if I'm not wrong, of the Atlantic pilot. There's also a question about, Dan, if you know if the Atlantic program is going to be extended. I believe I heard that, but you have far more information than this than I do. Can you comment on the role of smaller cities in immigrant resettlement and some of the initiatives that have been successful and not as successful?
Sure. So I actually took a slide, if you can believe it, I actually took a slide out of that presentation. It was so full of material that even I realized it's too overwhelming. And that slide was just a line by line look at the levels plan for 2021 through 2023. And on that slide, I distinguished between the ratio of economic class immigrants that are going to be, well, let's say admitted purely by Ottawa versus those that are going to be by some other order of government, either Quebec or through a provincial nominee program or the Atlantic pilot program or the Northern pilot program and so forth. And it turns out that we're looking at, roughly speaking, half and half. Ottawa has basically yielded half of its jurisdiction over the choice of economic immigrants to provincial or and increasingly perhaps even lower orders of government in the future. So we've really seen a big change on this, and what that's meant is quite a spectacular shift in settlement patterns over time. When I got into this this whole area of research back in the 1990s, at that point, roughly speaking, 4 out of 5 immigrants settled in the big 3 in Canada: Toronto, Montreal, Vancouver. Now it's not even 1 in 3, right? So now it's around the high 50s, 60%, whereas it used to be close to 80%. So that's already a 20% shift that's occurred from the big 3 into the Hamiltons, the Guelphs, the middle tier cities.
Yeah.
Exactly, and now with the northern and rural pilot program, obviously that's moving further in that direction. One of the things that surprised me a little bit in the 21 to 23 levels program was if you go back to the mandate letter that Minister Mendicino received when he was first appointed back in 2019, which seems like ancient history, it's only 1 year ago, but he was told in that mandate letter to get a municipal nomination program underway. And I thought that might be coming up in this sort of bigger vision that's being activated for 2021 to 2023. But if it's not there, I'm sure it will be coming soon. There will soon be a municipal nomination program, and that will go to the smaller municipalities of Canada, not the big ones. I don't think that Toronto and Vancouver and Montreal will receive anything beyond a tokenistic kind of number in that nomination program. It'll go to the places that are crying out for young people, that are crying out for newcomers to come into their labor markets. It'll be much more the Monktons of the world than the Torontos of the world that are going to be linked into that. So that's very much an issue for the future. And then now, if we turn to like your world, there's a really important question here, which is what we've seen over time is the crystallization of an amazing set of services for newcomers in the large cities of Canada that reflects this history. It reflects the history of the geographical patterns of settlement. And basically, well, I can speak with much more knowledge base about BC, but I think this is the same in Ontario. It really stems out of advocacy groups that formed in the 1960s and then professionalized their offering of support to newcomers in the 1970s. And the landscape then of services very much reflects 50 years ago and the kinds of people who got involved and the kinds of institutions that they established. And they're still relevant. There's nothing irrelevant about what's on the ground now. But what we haven't seen is an easy way to diffuse that landscape into the medium and smaller centers of Canada. So I hope I'm not going to go off on too much of a tangent here, but I want to draw a little parallel that I think is quite instructive. It's the same thing in Canada's corporate sector, in the sense that the big companies of Canada, the big banks and the airlines and so forth, they're really on board about diversity, right? Their human resources departments are all over this issue about the need to diversify the workforce. And in fact, if you want to talk even things like intersectionality with people in those roles, they know all about it. They know issues about, that there's this combination of race and gender and sexual orientation and all this kind of stuff. It's the medium and small enterprises of Canada that don't have the luxury of having human resources departments that can find out this stuff. And it's the same thing on a geographical scale when we compare the big cities of Canada with the medium and smaller cities of Canada. And they've got a double challenge. They've got to both work with how can they support newcomers, but they also have to work with how can they support their own populations to be welcoming to newcomers.
Exactly.
Because that's not been the history, right? That's not been the mode of growth of those particular places for the last 50 years. It was their history 100 years ago, but they've forgotten that, right? It's the recent history that they're remembering, and they're not on that wavelength yet. So there's a big task ahead to move the benefits, and especially the demographic and potential economic benefits of immigration across to what I call slow speed Canada, right? So in my own way of looking at Canada, I think of high speed Canada and slow speed Canada, which is a demographic way of understanding that the areas of Canada that attract immigrants have much faster rates of population growth than the areas of Canada that don't attract immigrants. So that's like high-speed Canada versus slow-speed Canada. And slow-speed Canada has a double challenge, right? Get the newcomers, but make them welcome at the same time.
Absolutely, and some growing pains there. And I know that the municipalities and towns engaged with the Association of Municipalities of Ontario, AMO, are very gung-ho on attracting and retaining immigrants. And so it's providing them with the support they need to create welcoming communities, to work, as you said, with their various community partners. I'm hoping that there has been some learning from the Northern and Rural pilot before we begin to roll out the municipal pilot. A few years ago, I moderated a panel of mayors in New Brunswick in in Fredericton, and I was surprised that on my panel were mayors of with populations of 1,000 people, little fishing villages, who are all gung-ho, right, about attracting immigrants. So the appetite is certainly there. I'm very cognizant of our time. We have about 10 minutes left. Let's talk about certification and licensing. Is it possible, this is from one of our colleagues on the call, is it possible that we will have changes in certification and licensing requirements for regulated professions as a result of the pandemic impact? And could those processes be simplified, especially for potential essential workers like international medical graduates? You should know that organizations like World Education Services, TRIAC, and OCASI, some of OCASI member organizations, including my colleague Emily Kovacs from Niagara, have been very much gung-ho and saw the pandemic as an opportunity to really push the provincial government in opening up spaces for internationally trained medical graduates. There is an ongoing conversation about this, but do you see this pandemic in the way that it's provided a window of opportunities around regularization of status for those who are deemed essential workers in the health field, to see an easing of the licensing requirements? We know that often the requirements are hoops that aren't necessary, for lack of a better term. Any comments, Dan?
I'm very sorry on this one. I bow to everybody else's expertise. I'm not a specialist on the credentialization side of things. Anything I say would not be any better than anything you would say.
And anything I said, no. Thanks for that. I so love your candidness. I know that Joan Atlin is on the call from World Education Services, and Joan has been playing a leadership role in having conversations with the long-term care homes, with folks at the province in terms of finding pathways to really amplify these conversations that we've been having for so many years here in Ontario. We have a new Fairness Commissioner. He and I had a really good conversation last week, so I know he's also paying attention to this. Joan, if you can write something in the question box just to inform all of us about where the conversation is or isn't, that will be very, very helpful. Women and intimate partner violence. We've seen such a sharp increase. The last stats I think I saw show that there's the Shelters of Canada, I believe, was reporting a 20 to 25% increase in calls to abuse women's shelters, primarily many, often from refugee and immigrant women. What role can the settlement sector play? Or Dan, what have you been hearing in BC? I know here in Ontario, it is certainly something we are paying attention to at OCASI. A lot of our work is on gender-based violence and developing toolkits and training curricula for frontline workers to be able to not only support, but also to do effective referrals for immigrant and refugee women. We know that many, especially in this economic times, are choosing to stay in the abusive situation because they have very little, if any, options. So any comments that you would want to make?
Again, others are much more expert at this than I am, but I will say one thing, which is the obvious connection between these issues and mental health.
Yes.
And I think that Canadians in general, whether it's about newcomers or about anybody, Canadians have underinvested in thinking about the importance of mental health, underinvested in mental health services for people, and a pandemic brings all of this right to the forefront, right? Because suddenly people are feeling more vulnerable, they're losing work, or they're at least feeling the threat of job loss. This turns very unfortunately to lots of mental health challenges for people, and we aren't as a society well equipped for this for anybody, never mind for the specific case of newcomers. So this is a national conversation that needs to be amplified, and you know, we just need to lose our inhibitions in a way in talking about mental health in Canada, and obviously that extends into the newcomer population as well, because of course that's the population that bring thousands of statistics to show that's the population that bears the brunt of, labor market, unemployment, and so forth in the first instance. So it's the population that's going to be most vulnerable to these kinds of issues. But we need like a much bigger national
Absolutely. Yes, absolutely. I must say that IRCC has recognized the need and have been funding some mental health programs. Same with PHAC, the Public Health Agency of Canada, who have been concentrating on Black communities and mental health. Recently issued a call for proposal around Black LGBT IQ plus folk and mental health. I was on a call the other day with Dr. Kwame McKenzie of the Wellesley Institute, and he talked about, and this was a surprise, that what they are starting to see is that for folks who have been diagnosed with COVID, regardless of their experience, asymptomatic or not, 2-3 months down the road, there's most likely going to be a diagnosis of some sort of mental health challenge. So that was very surprising and worrying. Just in terms of especially folks who may not have the language. There is a comment here around as we try to pivot to services online, what we're finding is that many immigrants and refugees, there are language barriers, but even more important, there are digital literacy barriers. So it's very difficult, right, to begin to meet those folks. But we're also finding that in terms of some of our frontline workers. So digital literacy, both for clients and for our sector, is critically important as well as we try to maintain a level of service to meet the increasing needs from mental health to domestic violence to job reskilling and job retraining.
That's such a valuable point. I just want to emphasize, just agree with you and emphasize what you just said. We kind of have to move into a digital era, but we also have to be aware of the fact that some people are going to be left behind unless there's some alternative pathways to services as well, right? So this is just a huge challenge because you parallel tracks on using the digital revolution, you could say, to help the largest number of people possible in the quickest amount of time possible, but still guard against who's being left behind.
Dan, thank you so much for this 2 hours of wonderful conversation and learning. We always appreciate spending time with you. Thank you to our 212 was at the height. Right now we're leaving with folks dropping off at 1:54. Have a fabulous rest of day, folks. Enjoy your weekend in Toronto. It is probably our last not so cool day for the year. So please go out and take a walk. Dan, I hope your weather in BC is warm and that you have the rest of the afternoon. Well, it's your morning. You have the rest of the day off so that you can go relax. Thank you all so much. Thank you, OCASI colleagues, for organizing this very informative webinar. Thank you all.